Well, the best thing you can do to prepare for that is to take care of yourself.
With the weather beginning to change, sicknesses are starting to spread. But how can you tell exactly what type of illness you're feeling?
It really just depends on how long you have your symptoms. And if you start to have a fever or if the symptoms start to get worse, and really that will determine what your next course of action is.
Experts say even if you feel sick, you should probably stay away from others.
Also, think about who's going to be there. Are you going to be around little children? Are you going to be around older adults that might be vulnerable and have a compromised immune system?
So, what is the difference between a cold, the flu, and COVID?
The things that I see that are different during the medical visits are if the symptoms are gradually getting worse, the coughing, congestion are just kind of slowly building. That seems to be more consistent with cold. Whereas the flu and COVID that we've been seeing, it seems like there's a much more acute onset of illness right away. You have these terrible body aches. Significant headache is probably one thing that I hear consistently. Most of the flu and COVID that we have seen has had a mild fever.
If you're unsure of what you may have, wait a couple of days and then reevaluate.
Many times when you're feeling symptoms for a day or two, it's kind of difficult to really figure out, is this a viral infection or bacterial infection? Of course, we have some tests and we can ask some questions and we can start gleaning some answers. But so many times I see patients come to urgent care with having had only symptoms for a few hours and having the expectation of getting a lot of answers. And sometimes that's quite difficult.